Hello, seniors. I am Dr. Sharon Malone. If you are a senior or if you care for someone who is, and you have ever checked blood pressure at home and suddenly seen a high number staring back at you are not alone. This happens to millions of older adults every single day. One moment you may feel completely fine, going about your normal routine, and the next moment your heart starts beating faster, not because of illness, but because of fear. A high blood pressure reading can be frightening, especially when it comes out of nowhere and you were not expecting it. Many seniors immediately begin to worry that something is seriously wrong, that they might be heading toward a stroke or a heart attack, or that their health is suddenly deteriorating. But the truth is, a blood pressure spike at home does not automatically mean danger, and in many cases, it does not even mean that your blood pressure is poorly controlled. Blood pressure is not a fixed number that stays the same all day long. It is constantly changing in response to what your body is doing and how your nervous system is reacting. Blood pressure can rise when you are stressed, anxious, tired, dehydrated, in pain, upset, or even excited. It can rise after walking, climbing stairs, eating a meal, or having a difficult conversation. It can also rise simply because you are worried about the reading itself. In fact, blood pressure can naturally fluctuate by 20 to 30 points throughout the day, even in healthy individuals. This is especially true in seniors, because aging blood vessels are more sensitive to stress and changes in the nervous system. One of the most common reasons seniors see high readings at home is anxiety. Many older adults feel nervous the moment they put the blood pressure cuff on their arm. They begin to anticipate a bad number, and that anticipation triggers a stress response in the body. Stress hormones like adrenaline are released, the heart beats faster, and blood vessels tighten. The result is a higher blood pressure reading that is driven by the body's alarm system, rather than by a true medical emergency. This creates a cycle where the high reading causes fear, and the fear causes the next reading to be even higher. Another common reason for blood pressure spikes at home is improper measurement technique. Something as simple as sitting incorrectly, crossing the legs, letting the arm hang down, talking during the measurement, or checking blood pressure immediately after walking or standing can cause the numbers to rise. Many seniors are never properly shown how to measure blood pressure at home, and small mistakes can easily add 10, 15, or even 20 points to a reading. Dehydration is another frequent contributor. Seniors often do not feel thirsty even when their body needs fluids, and dehydration can cause blood vessels to narrow, which raises blood pressure. Poor sleep, emotional stress, and the timing of blood pressure medication can also play a role. The most important thing to understand is that one high blood pressure reading does not define your health. Doctors do not make decisions based on a single number, and you should not panic based on one reading either. What matters most is how you feel, what was happening around the time of the measurement, and whether high readings are happening consistently over time. This understanding alone can take a great deal of fear out of the situation, and fear is often the biggest driver of blood pressure spikes at home. When you see a high reading, the first and most important thing to do is to stop and reset your body. Do not immediately recheck your blood pressure. Do not stand up and pace around the room. Do not rush to the phone or search the internet for worst-case scenarios. Simply stop what you are doing and give your body a chance to calm down. Sit in a sturdy chair with your back supported, your feet flat on the floor, and your legs uncrossed. Rest your arm on a table or armrest so that it is supported at heart level, with your palm facing upward. This position allows blood to flow naturally and prevents false elevations caused by muscle tension or poor posture. Once you are seated properly, focus on your breathing. Slow, deep breathing is one of the most powerful tools for lowering blood pressure naturally, and it works because it directly affects the nervous system. Breathe in slowly through your nose for about 4 seconds, hold gently for 2 seconds, and then breathe out slowly through your mouth for about 6 seconds. There is no need to force the breath or make it uncomfortable. The goal is simply to slow it down and make it steady. As you do this, your heart rate begins to slow, stress hormones decrease, and blood vessels begin to relax. This is not meditation, and it does not require any special training. It is a natural physiological response that helps bring the body back into balance. Continue this slow breathing for about 5 minutes. During this time, remain seated, quiet, and relaxed. Do not talk, do not watch upsetting television, and do not think about the numbers on the blood pressure monitor. Simply allow your body to settle. After 5 minutes, you can recheck your blood pressure if needed. Many seniors are surprised to see that the numbers are significantly lower the second time, sometimes by 10, 15, or even 20 points. This does not mean the first reading was wrong. It simply means the body was in a stressed state and needed time to calm down. The second important thing to do when blood pressure spikes at home is to look at the context, not just the number. A number by itself does not tell the full story. Ask yourself how you actually feel in that moment. Are you experiencing chest pain, shortness of breath, dizziness, confusion, weakness, or vision changes? Or do you feel generally okay, just worried by the reading? Consider what you were doing before you checked your blood pressure. Were you walking, cleaning, climbing stairs, eating, or feeling emotionally upset? Did you rest quietly before taking the measurement, or did you check it right away? Think about whether this reading is unusual for you, or whether you have been seeing similar numbers repeatedly over several days. Context is critical because blood pressure is meant to be interpreted over time, not in isolated moments. Doctors look for patterns, averages, and trends. They consider symptoms, medication timing, and overall health. You should take the same approach at home. A single spike, especially in the absence of symptoms, is usually not an emergency. However, if a high reading is accompanied by chest pain, severe headache, shortness of breath, confusion, weakness on one side of the body, vision loss, or fainting, that is a medical emergency and requires immediate attention. The key is to respond calmly and appropriately, rather than react with panic. Many seniors make the mistake of checking their blood pressure over and over again after seeing a high number. This often makes the situation worse, not better. Each repeated measurement increases anxiety, and anxiety keeps blood pressure elevated. Another common mistake is adjusting medication without consulting a doctor. Doubling a dose or skipping medication can be dangerous and should never be done without professional guidance. It is also important not to measure blood pressure incorrectly, as poor technique can create false readings that lead to unnecessary worry. For most seniors, checking blood pressure once in the morning and once in the evening is sufficient unless a healthcare provider advises otherwise. Measurements should be taken at the same times each day, in the same position, using the same arm. Consistency matters more than frequency. Using a validated home blood pressure monitor with the correct cuff size is also important, and bringing the monitor to a doctor's appointment once a year to check its accuracy can provide peace of mind. Over time, simple daily habits can help reduce blood pressure spikes. Staying well hydrated, getting adequate sleep, engaging in gentle physical activity, managing stress, limiting excessive salt intake, and taking medications consistently all contribute to more stable readings. These changes do not have to be extreme. Small, steady improvements make a meaningful difference over time. For caregivers, your role is incredibly important. Staying calm when a senior sees a high reading can help prevent panic. Encouraging proper posture, slow breathing, and patience before rechecking can make a significant difference. Helping track blood pressure trends rather than focusing on single numbers provides valuable information for healthcare providers and reduces unnecessary fear. If you are a senior watching or listening to this, remember that aging does not mean you are fragile or helpless. Many older adults live long, active, fulfilling lives while managing blood pressure successfully. A high reading does not mean you are failing, and it does not mean something terrible is about to happen. Knowledge brings confidence, calm action brings control, and consistency brings stability. When blood pressure spikes at home, remember these two things. First, stop, sit down, and reset your body with proper posture and slow breathing before doing anything else. Second, look at the full context instead of reacting to a single number. These two steps alone can prevent unnecessary fear, reduce stress-related spikes, and help you make better decisions about your health. Take a breath, give your body time to settle, and remember that you are not alone in this. Work with your healthcare provider, stay informed, and treat yourself with patience and kindness. Your health is more than a number on a screen, and you deserve calm, confident care at every stage of life.